Well, a big day is coming up near the end of the month, actually March 30th for the Alzheimer's Association. And with us today, the program manager to tell us more, Marybeth Torsell. It's the Ohio Advocacy Day, and thanks for coming today.
Thanks for having me.
Okay, so what does this day mean to you guys? I mean, why is it so important that a group gets down there and talk to lawmakers in Columbus?
So it's really important for the lawmakers to know what the people need. And so we go down with issues that, relate obviously to Alzheimer's and dementia, to request funding or various things that are ultimately going to help the people.
And, you're vying along with other organizations for some of this money, so it can be really critical to get good numbers there, I assume. I mean, what kind of things do you guys look for to make an impression on that day?
So a lot of times staff go down and we take volunteers. We like to take people who are actually caring for somebody with Alzheimer's, share their story. Sometimes we take people in the early stages of Alzheimer's to go down and talk about, like why it's important for some of these items, to like the one this year, public awareness bill. We would love to take somebody down there who benefited from an early diagnosis. So, we always look for people who are willing to share their stories.
Yeah, and you guys do focus on key issues, right? You just don't go down there and say, okay, let's give us money for this. But I mean, what are some of the issues that you're going to focus on this year?
So we have two asks specifically. The first one is a public awareness bill, and this bill is going to require or ask that the Ohio Department of Health create a specific designated outreach program that will educate, healthcare providers on timely diagnosis and why it's important to get an early diagnosis, and educate people on the warning signs of Alzheimer's and dementia so that they can get their early diagnosis.
Yeah, because we find that out, right? I mean, we still are working on a cure. At least there are some things you can do if you get diagnosed so early, right?
Yep, exactly. Yep. And then the second one is a respite item. Basically, it's an increase in funding. The Alzheimer's Association is funded partly through a grant that comes from the Ohio Department of Aging, and there hasn't been an increase in the past 4 budget cycles. So obviously cost, all the stuff goes up, all the prices rise, so we're asking for an increase in the budget.
Right, yeah. Well, it seems like Governor DeWine, I mean, he's well aware of like mental health issues and stuff like that, so it seems like health issues are on his mind. So do you guys feel good about bringing some of these things up?
Yes, actually, because Governor DeWine actually did propose an increase, so we are asking this, legislators to support that, his increase.
Right, yeah, because I mean, that helps caregivers and things like that. I mean,
it's going to provide respite. It's going to provide programs for the people who are caring for their loved ones with the disease, because it's very taxing, as we've talked about before.
Right, yeah, exactly. So is there still room then? If someone at home is watching, they're like, yeah, I would like to take part.
Yes.
Is there still a chance where maybe they can go and try to help make a difference?
Yes, definitely. They could always reach out to me or our 1-800 number or online. We're always willing to get people to come along with us.
Right, yeah. And there's also a little bit of a luncheon involved too and stuff.
Yeah, the lunch is actually always really good.
Oh, okay.
It is. It's really good food.
Right, so is it really an all-day thing, or is it mainly in the morning and then once you get to lunch it kind of wraps up, or how does it work?
It's an all-day thing. You get there like around 11, and then you have lunch, and then you have appointments with you. They have it all laid out. I mean, basically they tell you where you're going and you go.
All right, very good. Well, I assume that in our area, it's the whole state, so it's just not Northwest Ohio that's going to, right? But you need representation from our area?
We do. We definitely do. I think they're always looking for caregivers specifically, to tell their story. So we always need people to come.
Right, yeah. I assume that probably what hits home better for lawmakers if they hear someone's story rather than, not that you don't do a good job, but I'm the program manager with the Alzheimer's Association, right?
Exactly. They're thinking that I just am doing it for my job, but if you bring a caregiver in or somebody who can come in and tell their story, and they're always so heartfelt stories, and it just gets their point across, because that's who, they're serving the people of, their communities, and these are the people. So
right, yeah, I guess that is a good point. I mean, they're there just for their constituents, and that's who you're bringing there. So,
exactly. It's easier to say no to me, but you can't really say no to somebody who's spilling their heart out to you.
All right. So have we had success in the past? I mean, is there more legislation and more awareness, I think, about Alzheimer's, where lawmakers realize they need to pass some bills and things like that?
Yeah. In fact, last year we went down to ask them to support, and I don't remember what bill number it was, but basically it was requesting that it's mandated that first responders get yearly training on Alzheimer's and dementia, and that passed. So
That's good, yeah.
It worked.
That's a good one. First responders need to know about dementia and things like that. I think it was House Bill 23, by the way, from the notes that you sent me.
Thank you.
It's not like I knew it off the top of my head. A good example, though, so it works. So thank you very much for coming today,
Thanks
Marybeth,
for
and telling us
having
about it.
me. Thank you.
All right, don't go away. We'll take a look at the weather forecast next.